And do you think right now with what's happening at the government level, we talk about just government funds, you mentioned reimbursements and policy. Is that kind of taking an effect to what you guys are doing and how you guys are operating?
Yeah. It's everything. I mean, we, the healthcare system is from a provider side, a set of incentives. And so they incent us to do one thing or another and people flock and that's driving, what our healthcare system looks like. And the way the incentives are set today, yeah, they're about to change a lot. We are predominantly Medicaid. We probably in hospitals are probably 60% Medicaid, and we also do home and community-based services that are 99% Medicaid.
Yeah.
And so the I can't call it the one big beautiful bill. So OB3 it will dramatically change that scenario if it's implemented the way that it's currently designed. Politicians being politicians put all the goodies up front, right? The tax breaks are right away, and all the real cruelty happens later. And I think
Yep.
what we're seeing today, the government shutdown around the subsidies for the exchange, this is nothing. This is like a nuisance
Yep.
compared to what's coming. And what will happen, if all of it gets implemented, particularly what begins in 2028, when there's a new administration, politicians are savvy that way. You'd have hospitals failing. You're just taking away so much of the reimbursement. People get upset about the provider tax, and it's a gimmick. Well, it's how Congress set up payment for these hospitals. So
Yep.
without it, it doesn't work. And so you take it away, you're going to have hospitals fail. So yeah, it's always a factor. We feel good about our strategy around that, but it's an active strategy.
I was going to say that. Like, what does that look like, and how does it position yourself for the next 5 to 10 years? Is it just thinking different, working
Yeah.
outside the box, creating your own lane? Is that what it look like, Steve?
Yeah, it for sure it does. So we so specifically about provider tax, we have some provider tax exposure, but by the time it comes around, it won't be what it won't be critical to what we do. Now, I
Yeah.
actually think that will get kicked. I just they aren't going to let all those hospitals shut down. They're going to have to find a smarter way, and I have thoughts on that if they want some ideas. but
There you go.
but we aren't going to hope that legislators change the law. That's the law. We'll model around it. So what we're doing, so we've made a pretty significant move into home and community-based services, and the value to that to the payers is just really pretty extraordinary. That they're providing just great outcomes at very low cost. It isn't hospital level, so you're not getting the same. You're not going to cover the same
Yeah.
active, suicidal. Those folks still need to go to a hospital. But when they discharge, if they're getting into the home and community services, then they're very unlikely to move back into the hospital, into that crisis care, which is great. Just so you're lowering utilization, and we can do that. We're doing that in a number of states. So that's one area we'll do it, but we'll diversify away so that we're not come 2028, we're not exposed in a big way. But that's what we've done the whole time. When I started the business, Affordable Care Act was going to create challenges, and we designed our way through that as well.
I ask you, man, is there any, with just kind of the space that we're in, innovation happening in a sense of technology that could also help out? I mean, so many people kind of looking at the AI and how could we add that and leverage that as a less overhead, but still have the impact of if we're having
Yeah.
5, 10 more employees. Are you guys in that space as well, leveraging
Yeah,
that?
for sure. I'm super excited about it. We're using it pretty heavily in our intake department right now.
Love it.
So our intake, when you get a referral, you might get a 100-page fax, and it could be a mix of pictures and kind of a disorganized. Think about a PDF, but it could have, some of it's not very legible, and so our providers kind of have to quickly go through that, make an assessment as to whether we can cover whether we can care for the patient or not, whether they meet our criteria, and then whether we have the ability to take care of them. And we have AI now look at that referral in seconds. And so it's giving our providers a very good snapshot. We can ask any question we want of it, and so we've arranged the output that way, and it's allowing us to respond quickly to the referral source. So that's a way. There's another what I think would be game changing if we could make it work. There's some patient monitoring that I think can, using machine learning, that I think can really help our staff. That is not in deployment. We've done a little pilot on it, but if we can make that work, that's another just incredible leapfrog. So I think there are some areas, and then there's like ambient scribes, so you can have AI listening and do a first cut at the notes and things like that, that are kind of, even at this point, even more of a commodity, but some of the other areas that can really change the game.
Yeah, no, everything that you're saying is definitely one of those game changers. Some that I've seen implement them, and some that, as you mentioned, are kind of early in the space. But I think when we talk about just the ambient listening, I think there's so much leverage in that, right? It allows people to really do what they love more, Steve.
Exactly.
And really just focus on that patient versus always feeling the need of documentation and
Yeah.
making sure that every I is dotted and every T is crossed, because it's how you guys get paid, right? The documentation, that's just kind of one of the crucial pieces of it. So we can fix that, man. I think more people would even get into the space. We see what happened during pandemic. A lot of people left the healthcare just because they felt just kind of overwhelmed and exhausted on the work they were doing. Are not because I'm not in the healthcare space, but are we seeing an increase on what that actually looks like? People coming back to this space of healthcare.
Yeah, and I want to just circle back on something you just said, which is it helps our staff, and that is, we're not actually seeing any staff reduction. So that's I think what people miss is AI. I think it does cause some fear, but the reality is I think it can just make the job. It can make you so much more impactful in your job doing the work you want to be doing. So anyway, and then we do see people coming back. Obviously, 22 was really tough across the country. I think wage inflation was spike in 22 was we couldn't keep up with it. We just couldn't hire. We couldn't raise our prices. We couldn't raise our the amount we paid enough to get people back. And then at the end of 22, that started to change. In 23, it helped a lot. We'd had increased wages quite a bit, but we finally were getting people back. And then I think, interestingly, even all of these changes with what's happening to Medicaid, we're seeing some additional staff through. It might be a government agency that's getting consolidated, and so staff are freeing up for that, and so we're taking advantage of some of that. Some really good people getting let go, and then quite frankly, recessions are always better for our space than most. People with licenses that may not be fully utilizing them, maybe working part-time, need to come back and do more work, and so we'll see that increase. And so the challenges in the economy actually can help our ability to staff.